Hi, Jay. This is Daniela. How are you?
Good. How are you?
How you doing?
It's been a while, but I'm glad to be back with everybody. I'm doing well.
We are back. Jay, could you give me permission to record?
Absolutely.
Thank you.
Should have it. Anybody else who is not asked for the ability to record, just let me know. Josh, I'm going to make you co-host.
Hi, Jay. It's Tina from Arizona PBS. I was wondering if I could have permission to record too.
Yes, absolutely.
Thank you.
We already have in the chat a link to where the recording will be archived afterwards. So if any of you have any need for it or rather do it that way, that's fine. We've got a few more minutes, so. Again, anybody here who would like the ability to record, let me know. We do have a file available to you afterwards if you choose not to do that, so that you can get it on the back end.
Sorry, where can we get that file later?
It's in the chat. You
All right,
grab the
thanks.
link out of the chat. And you can send us a note afterwards as well if you miss it or lose it. Okay, everyone. I have muted most of you. If you could stay that way during the course of Dr. LeBaire's opening remarks, we will open it to question and answer after he is done making opening comments. Again, the chat has a link to a Dropbox file where this recording will be after the press conference is over. If you want the ability to record now, let me know. Otherwise, we're glad to see everyone again. Pleasure to be with you. We are going to have a few minutes, as I said, of opening comments from Dr. LeBaire on current trends in Arizona and nationally. We will continue to take follow-up questions afterwards. So if after this availability you have a desire for a further interview, further discussion with Dr. LeBaire, we are making him available to do that. But wanted to get together with everyone because we've been hearing from folks about the Delta variant and about other conditions, CDC, WHO recommendations. So with that, I will turn it over to the Executive Director of Arizona State University's Biodesign Institute, Dr. Joshua LeBaire.
Hey, everybody. It's good to see everybody again. It's been a little while. We promised we'd come back periodically as things evolve. So I thought it'd be a good opportunity to catch everyone up on what we're thinking. So, let's just start with where we are right now in the state. Right now, the 7-day trailing average of new cases is around 500. It's been hovering in that spot for quite a while. From one perspective, that's great news. That's a lot better than what we've been in the past over the course of the year. And so I think we're all happy to have it down in the hundreds instead of the many thousands. That said, it's not ideal. We are much worse than the state of Massachusetts, which has about the same population as Arizona. We are worse than the state of New York, which has many more people than the state of Arizona. And we're about the same as California, which is the most populous state in the country. So we could certainly do better than 500 cases a day. So it would be nice to see us do that. Probably we can take some solace that we're not as bad as Florida. And we're certainly not as bad as right now, Southern Missouri. I think some of you may be following that story. The combination of the Delta variant and a very low vaccination rate is overwhelming the medical system in Southern Missouri. So, there are places that are worse off than we are, but certainly we could do a little bit better than we're doing. Right now in the state, we're hovering around 500 cases a day in the hospital. That's the best it's been since the pandemic started, although there have been plenty of other days where 500 was sort of the hovering rate. Again, that's not great. That's 500 people in the hospital due to the virus, and about over 100 of those are in the ICU. And that jibes well with what we've talked about in the past, which is that if you're unvaccinated right now and you get COVID-19, you've got about a 1 in 5 chance of having a severe case that leads you to the ICU. So that's, if you're unvaccinated, it's like a gun with 5 chambers and one of them is loaded to take you to the ICU. So for those people who are unvaccinated, the risk is still pretty high. That said, we are seeing some breakthrough cases in people who are fully vaccinated. And so there's been some conversation about that. It's around 1 in 10,000. So it's much less common to get breakthrough cases than getting it if you're unvaccinated. And most breakthrough cases, the vast majority of them are, mild disease, sometimes moderate disease. We still, getting COVID-19 if you've been vaccinated and ending up with a severe case in the hospital is kind of lightning strikes rare. It's really pretty uncommon. It does happen. It is measurable, but it's something in the 1 in a million kind of thing. So it's really very uncommon. The one thing that's probably worth mentioning here, and this has been true for many years before this with other viral illnesses, and that is that as the percentage of the population that's vaccinated goes up, the number of people who have been vaccinated who get the virus will also go up. So breakthrough cases are more and more common as more and more people get vaccinated, and that's just simple mathematics. If 50% of our population is vaccinated with a vaccine that's 90% effective, 10% of cases will be due to people who've been vaccinated and still got the virus. And as the population gets to 70% vaccinated, then that number will double to 20%. So it's just no vaccine is perfect. And we know these vaccines are not perfect. Some people just don't mount a response to the vaccine. And it's a reminder that when we, the whole public health approach to this virus is kind of two-pronged. First, protect yourself by getting vaccinated, and that protects you personally. But also for those people who don't mount a huge response to the vaccine, the idea of achieving something close to herd immunity, the idea that the overall community is well vaccinated, will protect those people who don't mount a response because the virus spread will be limited. And so, we are, counting on each other effectively to get vaccinated and protect the herd, as it were. So, so that's the story, kind of where we're at. A lot of talk recently about the Delta variant. Many of you are familiar with the Alpha variant, or what was once called B117. That variant first arose, the 117 variant, the Alpha variant arose in the UK and was quite dominant here in Arizona for about 6 weeks, almost 2 months, starting from the beginning of April until the middle of June, really. The numbers look like that was the really predominant variant here. But as you've all followed in other parts of the world, the Delta variant, the 617 variant, has overtaken the Alpha variant. And the UK is now over 90% due to the Delta variant. In other parts of the world, it's become quite predominant. So we would expect that if the Delta variant appears here in Arizona, it will get a foothold. And my suspicion will be that it will become dominant here. Sequencing data from the state showed up until mid-June that we didn't see a lot of Delta variant. But what we did observe is the S gene dropout data. This is data coming from the ASU ABCTL lab, so our own saliva testing lab. The test we run here gives a real-time assessment of the Alpha variant because of this unique pattern that it generates. And we had been seeing for many weeks that it was dominant here. And suddenly around mid-June, it became much less dominant. The numbers went down. And I suspect that that's because the Delta variant is starting to rise here. And there's now increasing evidence from the sequencing labs that we're starting to see more Delta variants. So my suspicion is that in the next week or two, the Delta variant will become predominant in the state. We'll have to see, we'll have to wait for the sequencing data. That's always lagging by about 2 weeks. So it'll take a little while for us to accumulate that information, but I suspect that that's where we're going. So what does that mean? Well, the Delta variant is much more transmissible even than the Alpha variant was. It does cause, there's evidence to suggest that it causes more severe disease. I don't think we can say definitively that we haven't seen a published paper to show that yet, but certainly the reports we're hearing from other countries where it's become dominant suggest that. It also causes stronger disease in younger people. Now that part of that may be due to the fact that it causes more disease in younger people. It may also be due to the fact that in many of those countries, they've done a very good job of vaccinating the older population. And so we're seeing more infections in young people. But nonetheless, it does cause illness in young people. And that's something that we're going to have to watch for here. Worth mentioning that the Delta variant does respond to the vaccines. So people who are vaccinated are much less likely to get the Delta variant. It does protect the vaccines that are approved in the United States do protect against that variant. And that's all 3 of the vaccines that are in use right now in the US. So you can prevent the spread of this variant by just getting vaccinated. And that's, kind of an important take-home message in general here, which is that, we've seen the vaccination rate in Arizona slow quite a bit. We are still getting vaccines into arms daily, but not at the rate we were. The more people we get vaccinated, the less we have to worry about these variants. What causes these variants, and we've mentioned this in the past, is that when these viruses get into our cells, they take over the cells and they trick the cells into making more copies of the virus. And that copying process is error prone. Mutations are generated routinely just by making copies of virus. And sooner or later, one of those mutations will cause the virus to become more effective at transmission. And that's what happened with the Delta variant. It arose in a surge in, we think possibly India, at least that's where it was first observed. We don't know for sure, but it arose in, these variants arise in surges. And as long as there's virus spreading around, as long as there's a lot of virus in the community, there will be an opportunity for new variants to emerge that become resistant to vaccines or at least become highly transmissible. And so the more we can suppress the virus by getting vaccinated, the less likely that will happen. Last bit of comments, there's been a little bit of discussion going back and forth in the news about the question about mask wearing. The CDC came out with guidelines that suggested that if you're vaccinated and in the States, that you could largely stop wearing your mask, certainly outdoors and even indoors. The WHO is recommending still in some contexts to wear, even vaccinated individuals to wear masks indoors. The difference between the two is not as much as people seem to make it to be. Both organizations are emphasizing the importance of context, and that is to say, even if you're vaccinated, if you're indoors in a crowded situation, probably not a bad idea to wear a mask. We know that vaccinated people can get the virus. That's not only just asymptomatically, but even symptomatically. And certainly they could carry the virus if they get infected. So if you're in a situation where you're indoors and you're in a crowded circumstance, would probably be a good idea to wear a mask. If you're outdoors, my own feeling is that the risk of transmission outdoors is very low, certainly very, very low for people who are vaccinated. So I don't wear my mask anymore outdoors. It's nuanced, and no one likes to hear nuanced because nuanced is always complicated, but nonetheless it is. And I think the data suggests that people who are vaccinated are at very low risk of getting infected in general, extremely low risk of getting severely infected, and but they still could get the virus and they could transmit it. So if you're in a crowded circumstance, that's something to consider. I think that covers most of what I had here. Obviously there's been people out there talking about the fact that this virus is with us to stay. I think we have to acknowledge the fact that it's unlikely we're going to reach herd immunity anytime soon as a planet. Some countries are far behind the US in terms of vaccination. And as long as those countries, as long as there's people out there that are still infected, it's going to continue bouncing around the globe. So obviously, the more people we can get vaccinated, the better off everyone will be. But we have to acknowledge the fact that both because of the economics of it and also because it's clear that there are some people who are just not willing to take the vaccine. The virus is here to stay, and so we're going to always have to adapt to that to some degree. So I guess I will stop there and maybe take some questions.
Great. So, Bud, you had your hand up first, so just would like people to remember to identify who they're with. And Bud, we'll start with you.
Bud Foster from KOLD TV in Tucson. My question is how vulnerable do you believe that Arizona is to the Delta variant? Because we're only 50% vaccinated statewide. We have some counties like Apache, which is only 15%, and Mojave, which is 36%, and even here in Pima County, we're only 45%. So how vulnerable are we? And if we are vulnerable, how serious might this get here in our state?
Right. So that's a great question. So let's start with some of the key things. So in terms of the medical system, in terms of availability of hospital beds, in terms of availability of ICU beds, I think we're secure. All the modeling we've looked at suggests that we are not at risk for the kinds of surges we saw earlier this year or last summer and that sort of thing. So I think people will be able to get beds. That said, there is virus here. It's clearly spreading. I suspect that Delta is probably already here. It's probably already going to be a good fraction of the cases we see. And I suspect very soon it will become the dominant virus in the state. In places where there's really low vaccination rates, there's a greater concern. What we saw in southern Missouri, for example, where they had similar to Apache County, they had some serious problems. And so we probably should do the best we can to get folks in those counties well vaccinated. I think at 45% vaccination rates, and closer to 50% in Maricopa County, where there's already probably a pre-existing also population of people who've been infected and have some natural immunity. We probably aren't going to see, a surge like we've seen in the past. I think that's unlikely. But it comes down to the individual, and those people who are not vaccinated, they're at high risk. They will easily get infected by this very transmissible virus, and there's a 1 in 5 chance on average that they will end up severely ill from it. So something that we need to kind of keep a close eye on for those folks.
Nick Gerbis.
Thank you.
Nick.
Sorry, I was muted. This is Nick Gerbis from KJZZ News. I just wanted to be completely clear on, have we found evidence of Delta in the state, or have we not?
Yes, we've definitely sequenced some individuals with Delta in the state. The June data that's on the tracker suggests around 30%. I suspect it's going to be much higher than that, but I can't prove it yet because we can't identify Delta without sequencing, and there's about a 10 to 14 day lag to get sequence data. What I'm basing my assumption on is the fact that up until now, the gene dropout data on our laboratory has shown clear alpha dominance in the state, and that's vanished. That's gone down considerably. You can see that on our website if you check the S gene dropout data on our website. It's gone down quite a bit in the last 2 weeks, and that's kind of a real-time measurement. And my guess is that the only thing that could supplant alpha would be Delta. So I suspect that it's much higher now, but I can't prove it. Yeah.
So once upon a time, I knew the first name, but A. Devoid.
That's me. That's Alex. I'm Alex Devoid with the Arizona Daily Star.
Yes, sir.
So my question is about anti-vaxxers. Are the only people getting sick anti-vaxxers? Could anti-vaxxers potentially get others sick, like children who aren't eligible for the vaccine yet, those who developed natural immunity a while ago, or those who were vaccinated maybe at the beginning of the rollout?
Right. Well, okay. So, several questions buried in there. So I'm going to go from the last question first. So, so far the data suggests that people who got early vaccines, and because of the clinical lab that I run, I was one of those, are still immune. The data that we're looking at in the serology studies suggests that there's no reason to think that the vaccine's wearing off yet. So I think we don't know that for sure. We'll have to watch, but right now that's what it looks like. It's also true to say that people who've been vaccinated and people who've been infected both can get ill again. And we're seeing increasing numbers of people who were previously infected get reinfected, often with different strains, often with different viruses, increasing reports of that. There's some suggestion, looking at the serology data, that the immune response to the vaccine is much stronger than the immune response to the natural infection. That hasn't, there's still, we still need to document whether that translates to better immunity from the vaccine over the natural infection. But, the data that I've seen suggests to me that even if I had been infected, I'd want to still get vaccinated. And I would recommend that. So it's not only people who have not been vaccinated who can spread the virus. People who have been vaccinated or people who've been infected can spread the virus. But it is fair to say that people who've been vaccinated or people who've been naturally infected would spread the virus at a much lower rate than people who've not been vaccinated or infected at all. So people who don't have any natural immunity, they are at high risk of getting infected, and they will likely spread the virus.
Thank you. And children, are they? You mentioned children in relation to the Delta variant.
Yeah.
To protect them, is that why it might be a risk?
Yeah, we would like to protect them. Yeah, we would definitely like to protect them. I mean, I think it is fair to say that younger people tend to have less severe infections than older people do. but they do still get severe infections, and it's important to remember that it's a quarter or a third of the people who died in Arizona were middle-aged and younger. So this is not a virus that ignores young people, and young people do get ill. So we would like to protect those folks. And again, this gets to this point about if you're in a crowded circumstance and indoors, that might be a good time to wear masks.
Thanks. I'll pass off, but I might circle back with another question or two after everyone else has had a chance.
Sure.
Thanks, Alex. Claudia.
Hey, Claudia Rupsich from ABC 15 here in Phoenix. My question, I guess, is twofold. The first part is for parents watching our newscasts who are vaccinated and you kind of thought like this was done and hear about the Delta variant and it's more contagious and it seems to have more serious disease on people, including young people. What's the overall message here? Like, should they be worried? What should they be shifting anything that they're doing when it comes to planning, like your kids going back to school, summer activities? What do they need to know is the bottom line of the state of what's going on in Arizona and the fact that this will become the dominant, variant here very soon?
Right. I mean, I think, certainly everybody in the household who can get vaccinated ought to get vaccinated. I would say that schools have not proved to be a major source of infection. So I think it's safe to send the kids to school. I would say that when vaccines become available to younger people, I would get them vaccinated. And I would say probably avoid, really dense populations indoors without masks on. I would, if you're going to go to a school assembly, or if you're going to go to a concert, or you're going to be in a crowd indoors, probably wear masks for the kids, for sure.
But overall, if you're vaccinated right now, and maybe your kid is too young to be vaccinated, you're okay. You're protected, keep doing what you're doing and maybe just avoid large, dense crowds.
Yeah, I think that's right. Yeah. I mean, I think, it is certainly true that Arizona is in a much better place than it was, several months ago, for sure. Case rates are clearly down. And so I don't want to set off any panics here because I think we're still doing well, but it's not gone. The virus is still around. People are still getting infected. 500 people today are in the hospital with it. So, and that's been true now for several weeks. So we just want to be careful.
Gary Urcher.
Hey, Dr. LeBaire. The TGen sequencing dashboard also shows a rise in the P1 variant. And forgive the nomenclature, I know it sort of changed. I'm not sure if P1 is considered an alpha variant or not. But while I know we're all talking about the Delta variant, is this a concern? Is there enough difference between the P1 and the Delta variant to sort of cause concern there as well?
Yeah, the punchline on all the variants right now is that the vaccine protects against all of them, including Delta. So, for me, the big take home is get vaccinated. That by far is the best thing you can do to protect yourself against all the variants. The P1 is probably not as transmissible as Delta. My suspicion, based on what's happened in other countries, is that Delta will probably nudge the P1 out once it gets seated in the community. It's a little harder to predict here because spread is not common in Arizona anymore. I mean, the numbers are down, but we are seeing Delta variant, and over time it will start to, if it does what it did elsewhere, it will start to become more predominant.
Thank you.
Others.
I've got a couple more that I can ask if that's all right.
Sure.
Yeah.
So are we seeing any more breakthrough cases among the very elderly in long-term care facilities? Are you aware of any?
I'm not aware of any evidence of that. Yeah, no.
Okay. Do you think that more restrictions will be necessary in the short to medium term to mitigate the spread of the Delta variant?
I doubt that that's going to happen. And I think that if people are prudent, we'll probably be okay. Once again, the people who've been vaccinated are protected against Delta. And since, roughly close to half of Arizona is now either vaccinated or at least partially vaccinated. And hopefully that number will continue to grow. And then there's another sizable fraction of people here who've been infected and are also immune. So we're not seeing a lot of spread. So I don't know that we're going to need to do a lot of big policy changes. But it's a reminder that it's not gone yet. I mean, I don't know if I mentioned this statistic or not, but on a weekly basis right now, anywhere between 20 and 60 people are dying from COVID-19 in Arizona. And that is as bad as a bad flu season. So we're still in what would be considered a very bad flu season for COVID-19, and sometimes up to 3 times as bad as a bad flu season. So there are people still dying of it here. It's still around, and so we can't pretend like it's gone.
So this winter, what do you think the chances are of us overwhelming the hospitals again?
I don't think it's high. I don't think it's high. I think that we have enough overall immunity in the state right now that that's not likely to happen.
Okay. And then what percentage of our cases are sequenced? And do you think that number needs to increase just to get a better understanding of how widespread the Delta variant is?
I don't know what the percent is. I know that ASU has an active program. Any positive cases that we get, we sequence. So anything we get, but we're not seeing a lot of positive cases because overall the numbers are lower now, and the amount of, frankly, the amount of sequencing we're doing, the amount of testing we're doing is lower. I would argue that we're probably not doing enough testing anymore. People obviously are tired of the whole thing and they don't want to go get tested. And we would probably learn a lot by doing more testing. But I know TGen's doing a lot of sequencing. I know the University of Arizona is doing more sequencing. So, a lot of it's going on. And I would stay tuned. It takes a while for the samples to get from the positive labs to the sequencers to get sequenced. And that lag is what, slows us down from knowing where we're actually at.
Gotcha. Maybe I can find this out from the TGen dashboard. Do you have a rough estimate of how many cases, the percentage of cases that are being sequenced? Like, is it more than 5? Is it less than 5%?
Yeah, I don't know. I bet it's more than 5 at this point. I think, everybody, the state's been good about, encouraging us to sequence. And I think, they're funding Arizona State, they're funding TGen, they're funding a lot of groups to get that done.
Okay, thanks.
Yep.
Other questions? No?
All right.
Okay. Well, again, thank you for joining us. Glad to be with you. If you have any follow-up, please reach out to me. And good 4th of July. Thank you.
Have a good one, everybody.
Thank you.
Bye.
Just to give a heads up to cameras, when she's walking in the room, I'll probably move you guys over closer to the wall so you can get a straight on shot with her. But then I have to push you right back. So I'll let you guys know when we move over.
When she comes in, he's going to move us over there and we get like a straight on shot of her. And then once we've got a bit of it,
got it. It's over with. Are you okay?
Just getting through her, coming through the door. This way, guys. There are still patients sitting here. Nope, in. Yeah, nope, you're inside. ¿Cuál es mejor allá? Careful behind you, please. Yo me voy para allá. Good? Step on. You need to do the break. Are you good? I know. You want to very quick at the top and then we're moving back. Up to you.
So here's a paper towel.
A little bit more. 7 minutes. How about you, buddy? 41.
How are you doing? You got this, right? Right? I know what I'm saying. You get it. Observation
We're not done yet. Keep going. So when they get the results, positive. It's been very effective. We've got a bunch of them. Separation with when you're sitting here that we took yes, well, but now, in the laboratory, there's a lot of people that are close, and they get the results.
This is our observation area. So we're going to walk you through. Thank you for getting the vaccine. Thank you. What else? Thank you for getting vaccinated. Thank you.
No, it's like, I'll probably look at those sort of beer ones. I'm sure they're sort of
You showed up.
I'll probably go this weekend. I haven't had friends already in a long time. I just like those. I thought about being at the Jordan one, but there was a Jordan. I just get confused. And I was like, where is that one? That's what I sent you.
I like causing people.
Good afternoon and welcome to Isaac Middle School and the 7th Congressional District of Arizona for today's vaccination event. I'm always honored to serve this district, but I'm especially honored today to share this day with my constituents, our incredible healthcare workers and volunteers, community partners, and our special guest, First Lady, Dr. Jill Biden, and Second Gentleman, Douglas Emhoff. Thank you so much for being here. The commitment of have made to help get Americans vaccinated is critical to America's full recovery from the COVID-19 virus. Since January, we have made incredible progress in Arizona and across the country in getting people vaccinated. But there are still too many communities, especially communities of color, who have struggled to get access to vaccines and accurate information about the availability and benefits of vaccination. This has resulted in lower vaccination rates in communities like ours and left too many of our brothers and sisters vulnerable to becoming sick or dying of COVID. Your presence here today reminds us that we have to meet our people where they are at, whether it's at school, at church, the grocery store, or the local pharmacy. It means having trusted sources like friends, family members, neighbors, and community leaders sharing accurate information about the benefits of vaccination so we could keep our loved ones safe. It also means ensuring that people understand that vaccines are available to them regardless of immigration, status, or any language barrier. También necesitamos decirle a todos que las vacunas son seguras, gratuitas y accesibles para todos, sin importar su estado migratorio, especialmente para nuestros amigos y familiares que solo hablan español. Bríndenles la información que necesitan para vacunarse. Para obtener más información en español sobre las vacunas, llame 1-800-232-0233. Otra vez, para obtener más información en español sobre las vacunas, llame 1-800-232-0233. In a year where access to healthcare has never been more important, I am grateful to President Biden for everything he has done to support healthy communities and to protect and promote access to healthcare and the Affordable Health Care Act so that we may continue to meet America's public healthcare needs. This pandemic will not be over anywhere until everyone is covered by vaccines. And we have to start right here at home, working together to close this gap, end this pandemic, and save lives. I'm so grateful to the First Lady and Second Gentleman for being here today to share this message and help the people of Phoenix. Thank you.
Thank you so much, Congressman. Hi, everyone. It's such a pleasure and privilege to be here. My name is Ana de Carolis, and I'm a trainer with Made to Save. And I'm here today to talk a little bit about why it's so important to talk to our friends and family members about the COVID-19 vaccines. So let's start with a little engagement activity. How many of you have already decided to get vaccinated? Woo, amazing. And how many of you might know friends, family members in your life who have questions and they haven't gotten vaccinated yet? So thank you so much. We need you to talk to them. We need your help and support. COVID-19 vaccines are made to save lives, and we want this information to go out there. So let's talk about why having these conversations with friends and family members is so important. There is a lot of misinformation and disinformation around, and oftentimes our friends and family members don't know where to find that reliable and accurate information. You, as someone who they already know, are a trusted messenger, and you can support them in their journey to getting vaccinated. We all have a role to play in ending this pandemic and getting back to the moments that we miss the most. So, I'm here to provide some guidelines and tips around how to have these conversations with friends and family members. First and foremost, we're not telling people what to do or think. We're not trying to shame them into making a decision or forcing them to do anything. These conversations are here to support folks as they make their own decision. And also, you don't need to be a healthcare expert to have these conversations. We do have plenty of resources on our table and on our website to get informed, to share, but you as a trusted messenger can make a huge difference by having these conversations with your friends and your family members. So these are some tips and guidelines that we'd like to share with you. We don't have a script because every conversation is different. But the first guideline that we have is to build a conversation on trust. So before giving health facts and figures, before encouraging your friends or family members to get vaccinated, it's really important to build that trust and to build it based on understanding. So ask folks in your life to share more about their concerns, to share their questions. Try to get to the root of where their main concerns might be by asking, tell me more. The second guideline is empathy. So it's really important to demonstrate that empathy because getting vaccinated is a really important decision that we should all make for ourselves. And folks' concerns and questions are valid. So even if I disagree, even if I don't have the same question, we want to express that empathy and validate that their questions matter. For example, if I hear someone say that they're worried about any side effects, I would say, I hear you're concerned about any possible side effects, and it makes sense. You want to make sure your body is okay after getting vaccinated. So once we connect on those shared values, then we can support folks in our life find their own reason for getting vaccinated. Research shows that people are more likely to do something if they have their own reason to do it. And people are getting vaccinated for a variety of reasons, to protect their loved ones, to protect ourselves as we go to work, and many more. So we need to help our friends and family members find their own reason. And you can do this by sharing your story. In my case, I got vaccinated because I wanted to be able to do all the things that really keep me going, such as visit my sister and catch up, and see my nephew for his 3rd birthday party, which is coming up, see my grandma, give her a hug. All those things really matter to me, and I want to be able to do them without worrying about getting myself sick or my loved ones sick. That is my reason for getting vaccinated. What benefits do you see for getting vaccinated? By sharing your reason and asking folks what benefits they see, then you're helping them find their own reason. And finally, to wrap up the conversation, it's really good to do it with an action plan. Your conversation might lead to a range of outcomes, and that's okay. That doesn't mean you did a bad job. It only means you need to keep having these conversations. So if your friend or family member is ready to get vaccinated, you can offer your support. You can offer a ride or help finding a vaccination site near them. If they aren't ready, you can follow up a week later. You can offer support in finding more health facts to address their concerns. Just make sure you keep talking to them. We invite you to go by our table and find more information on ways to volunteer, ways to learn more. We have a training coming up today at 4. Visit our website at madetosave.org or sign up to volunteer at mobilize.us/madetosave. Thank you so much for being here and for taking action. The vaccines were made to save the moments we cherish the most, and we will get there faster by having these conversations with family and friends. Thank you.
Just how